be interviewing Dr. Charlie Eastman at Number One Health.
Okay.
Hi Charlie. Chatting today about occupational health. Can you explain to me what is occupational health?
Yeah, occupational health is looking after the welfare of employees, and it was started in a scientific sense by an Italian called Ramazzini, and he looked at the work being done by sewage workers, made a link with the things they were exposed to, and advised people how to reduce those illnesses. And also in Dickens's time, it turned out that a lot of the kids who were chimney sweeps and went up and down the soot got exposed to things that gave them cancer risks. So occupational health is about knowing what exposures the individual has. Is the individual healthy for the job? Is the job healthy for the individual? How do you deal with sickness absence? How do you deal with short sickness absence, long sickness absence, return to work? How do you deal with health promotion and issues like that?
Okay, so I mean, how many companies in the UK bother to have this?
Yeah, surprisingly, there's been some work done by the Health and Safety Executive, and they think that less than a quarter of British companies have any sort of provision, and that's companies with 20 or more employees. So I would say there's a real shortage of that service in the United Kingdom.
And it's one that's needed, you believe?
I strongly believe so, because there are lots of benefits to it. If you look after your employees better, then you increase productivity and maximise their sense of well-being as well.
I was going to say, how much do you think it actually costs these companies not to have occupational health?
Yeah, I think it costs them a lot, and I was recently overseas and I asked one of the companies what the longest time an employee had been away from work. They told me 6 years. Now, they were paying a salary for 6 years in a situation where it could be better managed, and it doesn't make sense to do things like that.
Do you think companies can be exploited by that, by not having occupational health?
They can be exploited in the sense that they can get it terribly wrong, and in getting it terribly wrong, it costs them money. If I give you a very simple example, if you have an employee who, say, does something not to do with work, say they play football on a Sunday, injure their ankle, they ring in and say, I can't come into work. If you don't have any sort of opt-out service, you may just accept that, and it may take them weeks or months to then come into work. Now, you've lost all that work time. If you have opt-out, you might say, well, actually, after a short period of time, let's call the chap in, do an assessment, decide whether we as a company want to pay for some private physio or something like that, and of course get them back to work much quicker, so it makes more sense in that sense.
So what do you think companies should do about short-term, long sickness absences?
Yeah. Short-term sickness absence needs to be dealt with very robustly. Firstly, a lot of companies don't even monitor it properly. So there are people who have, for example, Mondayitis or holidayitis. So every time there's a Monday, they happen to be sick. Now, if you're not measuring that, someone could get away with several Mondays where they've either, let's say, been out on the booze or done something else that meant that they didn't want to come in. So certainly companies should monitor how many sick days the individual takes. And they should have a limit after which they investigate further. So what we recommend is say about a 2-week limit. So if someone's already taken 14 days off sick, call them in and say that you are concerned about their pattern of sickness absence. You then identify whether it's a particular, a one-off event. So if someone had rode out and was away for 2 weeks, and that's a separate thing. But if someone was sick every Monday, then you'd say that's a pattern that we're not particularly happy with. You would warn them that you have the right to ask them to see an independent occupational health doctor to get a view for you as to whether what to do next, and say that from then on, any sickness has to be reported to their line manager, so that you're now taking a bit more control of the situation.
Which leads me to the question, I mean, do you think a lot of companies do have a problem with line management?
Absolutely, and you know, the classic thing is it's lovely to be promoted, but often people get promoted to the level of incompetence. It's something that's known as the PISA principle. So someone was a great, coordinator of some activity, suddenly they're in charge of people. And people are the scariest things to be in charge of, because I always say that your greatest hassle and your greatest asset at the same time, because people are temperamental, they're not machines, they're emotional and everything else. And suddenly you're elevated to this position of managing people, and sometimes there's someone who's not working effectively, but you don't want to tell them because you don't want the confrontation. Someone is taking the mickey in terms of the amount of time that they're away from work or the hours they come in. Again, people don't want to tackle that. As an occupational health doctor, what I've found is that we often are given a problem, which is what I call downstream. So someone is by now quite stressed and quite ill, and we're asked to solve it. Whereas often I think the problem was actually upstream because they didn't have decent line management, which would have solved the problem much earlier than when they came to me.
So troubleshooting.
Absolutely.
Yeah, so what do you think is the minimum that the line manager ought to know? What's the absolute minimum?
They need to know how to manage discipline and how to manage absence. So if we look at discipline, for example, if someone does something that's not within your conduct rules, you need to clearly give them at least a verbal warning to start with. If subsequent to that they do the same again, you need to give them a written warning. And if they do that again, then you dismiss them. Now, every employee needs to be aware that that's a sequence of events. If they're not aware of that, then of course they will string it out and you're back to square one. So certainly managing that and managing the absence are key things.
Key things. And if I needed to make an occupational health referral to your company, how would I go about that?
Really good question, and what we need is consent. So when we consent from the individual that they're happy for us to see them and happy to ask their GP for reports and happy to report back to the company, this is really important. What we also need to know from you and your company is what is their job, so that we can assess whether the problem impacts on the nature of their work. And the more we can know about what you expect them to do compared to the problem they have, the more we can help you with a sensible report.
Do you think they're sometimes blinded by not being afraid to do the wrong thing?
Absolutely. There's lots of cases I can quote you where companies have been scared. In fact, I can name a major retail chain where the individual had a personality disorder and everyone was scared of him. And as a consequence, the impact that person had on the rest of the company was phenomenal, because people saw really bad behaviour tolerated, which was unacceptable.
That could escalate.
Absolutely.
Yes. How would you manage a return to work? What would your strategy be?
Absolutely. First thing I'd do is get as many reports as I could to clarify what the issues were, what rehabilitation the person had, what impact they had. And sometimes the impact is suboptimal. We have a client who works for an engineering firm. He injured his arm socially, shall we say, 6 months ago. By the time I'd seen him, he hadn't even seen a physio. Now, he could have seen a physio in all of that time and been at a better stage than when I saw the individual. So what we do is we assess whether they've had optimal input up to then. One of the rules, I think, and I really do plead with people, is never put someone on light duties. Light duties, just erase that from your line of business things, because it means nothing. So either someone's competent to do a job that you've outlined for them to do, and they may need 1 or 2 days a week as opposed to a full week before they get back, and they gradually build their way up. And with stress, for example, it's so essential that you manage their workload so that they don't say, I'm stressed again because you didn't manage to work there that made me stressed originally.
So it's incremental.
Absolutely.
Okay. So tell me more about what Number One Health has to offer in these situations.
Yeah. We work with 50 different corporates, all in the FT 500, and we help them with both sickness absence, return to work, all of these issues. And sometimes we also like to do management by walkabout, and it's quite good for us sometimes to come into the company, see what the people do, and get to understand it. A colleague of mine worked with a car firm, and she was able to save them millions of pounds a year by one simple bit of advice, which was everyone was getting back injuries, and she said you need to raise the height at which they work, and by raising that by 1 foot, she saved them millions of pounds from back injuries.
That's extraordinary. So if the company has a doctor, where do you come in?
If they've already got a doctor, then we can be on speed dial and be a support to them. The quality of company doctors varies, to be honest, and we can also help them get emergency appointments, because we've got fantastic links with specialists up and down the length of Harley Street.
Okay, and if the company already has health insurance, how would we need you?
Yeah, health insurance is interesting because it doesn't cover everything, as you know. So you get policies that might not cover, for example, a private GP, certain types of specialists, etc., etc. So we can help in all of those areas. So our plea is for companies to have us on speed dial.
Okay, well, if you need any more information, you can contact Charlie and his colleagues at www.numberonehealth.co.uk. Thank you very much, Charlie.
Thank you.